diagnosed with breast cancer July of 2022. I was 32 years old at the time. When I went to the gynecologist, I had a quick breast exam, and the PA felt that one breast was more dense than the other.
Based on the size of the mass, it was stage 2 breast cancer. As far as the type of breast cancer, it's extremely important. It was estrogen-positive breast cancer, which makes it a little bit different from some of the other types of breast cancer. So we developed a personalized treatment plan for her.
I would say the most important things for patients are to not ignore changes on their breast. I always tell my patients to make sure that you know how your breasts look like and feel. So if there is a change, you bring it to your practitioner.
The mammogram popped up that there was something there, and the biopsy showed us that it was breast cancer. I didn't think that this was something that I would ever have to go through. I don't have a family of breast cancer, so because of this, it was very shocking to me. I had to get chemotherapy every 2 weeks from September through January. Some days I couldn't get out of bed for about two or three days. I first lost my hair, my second session. Then I lost my eyebrows. I felt very self-conscious. I lost everything that made me feel like a woman is what I lost.
So our breast center is known for personalized care. We really serve our community here, and we are a nationally accredited center from the NAPBC. We have all of the best technologies, the newest innovations, and expertise, the care of doctors that can help treat all of our patients here on Long Island.
She's undergoing anti-estrogen therapy. Ovarian suppression is part of the anti-estrogen therapy. That continues anywhere from minimum 5 years of ovarian suppression, and the pills continue for up to 10 years. So she will be following up very closely every few months with us, and hopefully that will lead to an excellent prognosis and cure in the next few years.
While I was going through chemotherapy, I was still in grad school. It was such a blessing that I was able to graduate on time. I did graduate with my master's from Fordham University in May, a couple months after chemotherapy, which is huge for me. I didn't want to give up who I was. I didn't want to pause my goals. I was so close to graduation. There was no way that I was just going to give up schooling. There was no way I was going to give up my career. I've been teaching for 5 years now, and I love the students. I love what I do.
What we are trying to do is give the best treatment with the less side effects, the quickest treatments, so that the patient will have a good survival and outcome, and I am proud to say that our patients do extremely well. Another thing that people should know is to go to a healthcare system where they are comfortable with expertise care. So once breast cancer or some abnormality is detected, you need a team surrounding you. And that's what we do here at Mount Sinai South Nassau.
I chose Mount Sinai South Nassau because I did my research and I saw a lot of patient reviews, and everyone was saying that Dr. Thakker was one of the best oncologists. The nurses on the floor of the infusion center, they were the most caring, kind. We talked about everything. Dr. Thakker was so supportive in my journey. She called me her superstar because she couldn't believe that I was juggling school, work, and chemo all at the same time. But she was always there when I needed her. How are you feeling? You know, how is school? How is the work? It's just a catch up, and that catch up is what you need. That shows friendliness. I'm not just there to be your doctor. I'm there to show you that, I care about you and I'm interested in your life.
I always encourage against self-breast exam, mostly the skin exam, chest wall exam.
Please go for your screening mammogram. So this is very, very important, so that even if you don't have any problems on the breast, screening still finds most breast cancers, and this is usually done once a year, and that screening mammogram is very, very valuable.
You're not always going to have good days. You're going to have a lot of bad days, but don't let those bad days define your entire life. Try to get yourself out of bed. Think about your goals and just think that you're not going to be in this situation forever.